So that could be that could be one of the biggest challenges that you've been facing, just like trying to promote that being a hygienist is something in the Middle East. Since you came here at first, was it something like, did you come with a potential of patients that are asking questions, what that could be, or even asking them, how can this thing benefit me on a from a personal aspect?
Yeah, I think before even my patients, it was something I had to educate my colleagues.
Yeah.
Because especially, I work for Harmony.
Yeah.
And I'm the first hygienist in the company. And the company's massive, right? So
Yeah,
it's
exactly.
an honor.
Of course.
But obviously being the first is not always the best, right? Because I have to be, the pioneer and the Viking towards this to kind of like educate the dentists, my colleagues on who've never met or heard or worked with a hygienist. Because, I have a few Arab colleagues in other countries, that don't know about it. So it's kind of like you're trying to show like, I'm important and my job matters. I'm here for a reason. Sometimes it gets a bit, stressful. It's hard because you think you're always proving yourself, right?
True.
And I chose my job because I love it. I chose my job because I love what the patient says to me and how I make them feel and how they make me feel, right? That's the way I can give back to the community, right? So when I'm sitting there, I think the first part was mostly the colleagues in my surroundings and like people like you, at work. And it's like, what do you do? I never heard of you. So it's fine. I like to educate it, but I need people to understand that hygienists are not just cleaners. We don't just pick at teeth,
So another question, depending on the same thing. Do you think it could affect your marketing propaganda on social media if you sit down as a hygienist? Do you think people would understand that thing from the beginning, or need to elaborate more and spend some more effort, just prove what you're doing is important for them?
Not necessarily like propaganda or marketing. I think the thing with patients is, especially here, a lot of my expat patients, of course, like they know they had their own hygienist back home. I had my own hygienist back home, right? So that is okay because, of course, the best thing about Dubai is there's a lot of expat, so it kind of helps us there, right?
You didn't feel anything. Yeah.
Well, no, you do a bit, but it doesn't. It's not that.
Yeah.
Like, oh my God, what is that? Because there's so many expats, and they want a hygienist. They don't want a dentist for cleaning. They want a hygienist. So, but I mean, with the Arab culture, they automatically just think all dentists, all doctors, you're just a doctor, you're just a dentist, you're just doing it. Yeah. They don't know what it is.
Yeah.
But when we explain to them what it is, they're like, oh, okay. Like, so, they're very more intrigued. And when you tell them, like, I'm not a treatment provider, I'm a preventative. And they're like, especially with the young youth people, individuals now, it's people are so, no, I say they're more, the opposite. People want more to sustain their own teeth. They're very health cautious and they like asking questions. Before there was a language barrier and now mostly everybody speaks English, right?
That's true.
So, there's ChatGPT and there's so many things out there that people can get information about what does she do and why is it important? And when you sit there and you tell them, hey, you can keep your teeth until you're 100. And they're like, no, but I'm supposed to lose my teeth. No.
Just having a hygienist?
Yeah.
That can do something.
And listen, not just having a hygienist. This is the thing. You have to do the homework at home. You can't. Homework? As in, like, you have to take care of your teeth. You gotta floss. You gotta brush. I always say you can't just come to the hygienist and be like, every 4 months I'm gonna keep my teeth. No, it's back and forth. You can treat it in the right way. Yeah. I'll tell you this. I had a patient in Switzerland. I'll never forget this patient. He was a Swiss Italian patient. He was 99 years old. Okay, and he used to come every 4 months to his appointments. He had all of his teeth, including the wisdom. He used to take a bike to work. Wow. And we had an elevator and 2 flights of stairs, right? He's not gonna use He used to take the stairs up and come by himself, okay? And I was astonished because his oral hygiene was immaculate.
It's a mindset.
He was 99, but he took care of his teeth. He was healthy. He used to bike, walk, and come by himself. I was like, wow. Impressive. Because I was like, you have all your teeth. He didn't have one implant or, a bridge. And this is where the misconception comes into, listen, I come from a Middle Eastern background too. My grandpa had a denture and I thought that was normal before I went to dentistry because why? As you age, you lose your teeth, right? That's what you think. No, that's false. That's false. You can have your teeth for the rest of your life, right? So, but I think that's what I try to teach my Arab culture. So, but I'm getting older. When I tell my patients, but why is this happening? I'm getting older. I said, no.
It's about how we deal with it.
It's how you take care of your teeth. It has nothing to do with your age.
True.
right?
True.
So this is what I try to tell them. You can keep your teeth. People are just in the mindset, yeah, they're going to fall out anyway, so I'll just do an implant. No.
So do you have any stories in your mind that can be mind-blowing? For example, a patient that was refusing getting treated by any means. Like, for example, I've heard that you cannot do any treatment, especially in dentistry, if the patient is not accepting. Because it could
That's in any field.
It could be, but it could be like sometimes it could be because he's under. I'm gonna say it wrong that way.
Anesthesia.
Anesthesia.
Yeah.
It could be he could be under or she could be under anesthesia. In this case, the doctor should interfere himself and take a decision. But in dentistry, it's not going to be something, I guess. So, have you ever faced something that you felt like he really needs or she really needs the treatment, but they were refusing to get it for any reason? It could be cultural, it could be religious, it could be whatever.
Not necessarily. I think everyone's pretty prone to being good at what they do. I think the only issue I have with my patients sometimes is they don't like taking X-rays, and this thing that everybody's
I guess for the propaganda that they're gonna get cancer, like I guess that's what.
Radiation, and I'm like, you can get it from anything. You get it from the sun. You get it when you're traveling on the aircraft. It's everywhere, right? But that radiation, that's minimal radiation. Can save a life. And I had a patient in Munich, in Germany.
Yeah.
And she came, I think I saw her for about a year, and she was refusing, but she had a lot going on at the bottom of her mouth. And I kept saying, like, I need to take a radiograph because people don't understand that we need an X-ray because that's basically our instructions on how to work and what to do, right? It's like opening something from IKEA. You know, you have a book. And you're like, you gotta do this, you gotta do this, you gotta do this, right? It's a manual, and that's literally what it is. It's a work manual for us to know what's going on and what needs to be done to how to fix it. So when we don't have X-rays, it's kind of we're working blindly.
Yeah.
Like in the naked eye, there's so much we can see.
Of course.
So she refused for a bit, and I really sat with her, and I was like, I really need to take it, right? And it's not a very happy story for me because we did end up taking it. And obviously I'm not in the qualified position to tell her what I see in the X-ray, but it was a cancerous lesion. It was eating away at her bone, right? So I don't know what happened because I did leave there and move to Zurich afterwards, but we did get that and we shared that X-ray with her and we said, you need to go get, medical attention.
So it was beneficial, at least she got to know something that she didn't know.
Exactly, and people don't understand that we're not just taking X-rays to see if you have a cavity. Right? We're seeing the whole level. There's so many of my patients that I take X-rays for, and I'm like, hey, are you mouth breathing? And they're like, why? You have a deviated septum. I'm not an ENT, So, what do you mean? I could see it in your CBCT X-ray. And then you show them. And what I love about it is, when I have it, especially if you're my patient.
Let's elaborate that more because I don't think everybody will understand that it could differ, even it could change the structure of the mouth if you're a mouth breather.
There's so much that can happen. It causes bacteria accumulation because you have dry mouth, so you get sensitive gums, red gums, inflamed gums. And I noticed this if it's not a deviated septum, right? Are you a runner? Are you playing sports because you're not wearing a sports card? There's so much you could see with that. But I mean, with X-rays, I love it because how do I say it? When you look at an X-ray, you just see black and white. You're just like, you're like, what are you looking at, right? But I love to sit with you, and I'll take that extra 10 minutes and compare your one healthy tooth to the other tooth that's a problem and show you the difference so you can kind of see what I'm talking about as to why we need to take X-rays. And I want you to be able to understand what I'm seeing. And I'm not just saying, hey, Noor, you have 2 holes in your mouth. You're like, what do you mean? I don't feel anything. I don't have no pain. No. And I say education is key. True. But I can't educate you if I don't have that tool.
The evidence to
which
show
is
you.
X-ray, right? So this is one thing I kind of deal with my patients. But again, baby steps. You don't force anybody. You don't, so you just like, this is the reason. But please sign this document that there's an informed
to make everything clear from the beginning,
that you don't want to do it, right? So we have to kind of save ourselves as well in the medical field because God forbid something happens. They were like, I went to the dentist, but they didn't take an X-ray.